Hi, everyone. Thank you so much for joining us today. My name is Angela Love-Zarenka, and I am with Lactation Education Resources. And we are so honored to have Nikki and Nikki with us today. Nikisha and Nikki will introduce themselves, but I just want to thank you for joining us for our presentation on COVID-19 and how you can support the families who are in your community. I'll go ahead and turn it over. Thank you.
Hey everyone.
Hey, welcome to the party.
I'm Nikki Greenaway. I'm a family nurse practitioner and an IBCLC, and I have a private practice in New Orleans where I do almost all home visits, perinatal, so prenatal, postpartum, and some lactation home visits. And I'm the co-founder of Nikki and Nikki Lactation Career Consultants, where we're trying to help folks, primarily people of color, become IBCLCs.
Yeah, and I am Nikki Killings or Nikisha Killings, and I am a private practice IBCLC and equity strategist. So I handle equity and inclusion for lactation education resources, who so kindly have provided this platform today for us to answer questions for you and just have a conversation.
Yes.
Yeah, I do community support as well. So community support groups and visiting parents, generally, formerly in home. Right now, things are completely different. Nikki, how does it look different in New Orleans where you are?
It's pretty bad here, actually. And it's pretty bad here. Our numbers are going up. I think we are at about 1,500 cases right now in the state of Louisiana, and we have maybe about almost 1,000 here in New Orleans. We've had about 20. No, I think we're more than that. It changes daily. Like there's a ticker
Yeah,
on our thing. So it's it's constantly changing, and we can't even say by the day. It's changing by the hour as far as guidelines and things like that. So that's kind of why Nikki and I wanted to get together and kind of say, hey, y'all, let's talk about it, family.
yeah, yeah,
Let's
yeah.
get the facts out there. And I know there's a lot of sharing of misinformation and just kind of just this ball of yarn all twisted in our heads of like what's going on and why is it changing? And it's changing our practices and changing the way we live in. So we
Yeah,
think it's important.
I agree. I think this is probably the beginning of a new era. I think we'll all be doing practice differently post COVID-19. So much is changing in the way that we uh, approach lactation work. And you probably are all experiencing the same things, listeners, no matter where you are, that you're having to approach the work a lot differently now. And this will probably be some changes that we're implementing that will be lasting. So it's crazy in Los Angeles. It is, we're in scary times. Me and my children have been in home for 14 days. Yeah. Um, that was, we started to self quarantine even before it was mandated by the state,
Hmm.
but Los Angeles has been, the whole state of California has been in lockdown for several days now. So we are all in that position now. We just made a decision a little bit earlier because we could see where this thing was going.
Right.
And folks weren't really taking it very seriously. So um, what our governor or mayor is saying is that we're about 6 days behind New York.
Okay.
And you all see New York in the news a lot. You see
Right.
Governor Cuomo talking about just, they're in a bad position and it's about to all hit the fan here in a matter of days. And so
Hmm.
we're maybe a week behind them. It's going to be as bad in Los Angeles. So we're in gearing up mode. We're in stay home at all costs mode. I
Right.
just saw an article where the mayor of Los Angeles was saying they're going to shut off power and water to businesses that are still staying open that are not
What?
essential. Like they are forcing
Wow.
everyone to stay home. So
Wow.
it's serious. And I feel
Yeah.
badly for small businesses. Some of us are small businesses who had to shutter our places of work. And now we're having to do this thing a lot differently. So how
Right.
can families still be supported? That's the big question. And how can we do so in a way that protects us and protects the families?
Right, right. And in New Orleans here, we kind of have so there are periods of time where work is kind of stagnant for people doing home visits. And we just got off of Mardi Gras. So during Mardi Gras, you can't do a whole lot, can't move around. You counseling people over the phone because you can't get through with parades or people's schedules or things like that. And then we're like, okay, now we're getting into a zone where this is work time.
Yeah.
Nope, it's not work time
Nope.
because now
Well,
we have a pandemic in our city. And so, folks are slowly but surely moving over to these telehealth things. Working with LER and putting out some guidelines for telehealth. I know for myself at the New Orleans Breastfeeding Center, we did a whole week of telehealth last week, and it was awesome. Like, I mean, we do telehealth like Google Hangouts. We chat.
yeah.
But to actually see people have like a true visit, break down the visit, tell the problem, interventions, questions, plan, all that kind of stuff. That was new for us, but it
Can
worked
we?
well.
Yeah, go ahead. Sorry, didn't mean to cut you off there.
No,
I'm
no, it's
excited.
okay.
I want to know, let's talk through, I want to talk through the anatomy of a consult. Like, as we're
Right.
waiting for questions to come in, Nikki and I are just
Mhm.
going to chat. Y'all feel free to type them in, and Angela will interrupt us and let us know as questions come in. But even before we get to what a consult might look like, let's talk about how we even tell folks that we're still here. Hey,
Right.
still here if you need help. What have
Right.
you done, Nikki?
We've done social media, but also with social media, we have to understand that sometimes families are not on social media, especially like right now, because of all this negative energy that is coming from them. So they've distanced themselves from social media. You'd be surprised at how many people are not getting their news and facts and events and all that kind of stuff from social media. They just want to lay low. So we've been reaching out. We have a text message thing where we can send out mass text messages. And we also have our newsletter. We do a MailChimp because some people, they're still getting their emails because for work, if they're working from home or whatever, that's the way they're communicating with folks. So we did a MailChimp and we send it out that way. And we're just testing our clients, like our past clients. We went down the list and started just sending them what we've posted on social media. We sent that to them, like, hey, we're still available to you. We send it out to the hospitals, anybody that we usually do our marketing with, pediatricians' offices, because they're going to get the calls, lactation departments, they're going to get the calls. There's no outpatient lactation going on right now at hospitals. So those are the people that we reached out to, and we encourage you to tap into those at your hospitals because they're turning people away and they really don't have any answers. If nobody's hitting them up, they're not about to stop and hit you up. So you need to
Absolutely.
call them.
They got a lot going on. Hey, I want to stick a pin there because I think text messaging is brilliant right
Oh,
now.
yeah.
So as you all might have noticed, those of you who are active on social media, there's some glitchiness happening because
Right.
everybody's home and on their phone. My device is telling me how many hours a day I'm averaging, and
I
it's a
know. Mine went up
shame.
12%.
It's a shame. It's a shame. But so even if you are on social media, it may be moving slow, maybe glitchy right now, maybe removing posts, so you may not see some. There was a whole
Right.
glitch last week where random posts were being erased and brought down as and claimed to be spam because they had a kind of an artificial intelligence interface on Facebook. Scanning through the posts and trying to find spam. So your messaging on social media may be lost at this moment, may be really
Right.
hard to find. So text messaging is a great way. It's a quick way to get in front of parents,
Mhm.
give them a really short message, but be to the point, say what needs to be said. And I love that. I'm going to try and implement that. Thank you for that idea.
Yeah.
That's fantastic. All right, so we let them know we're here. We're still here. We're still available
Right.
to you. Parent calls and says, "All right, I need you to look at this. Baby, it's not working. How can
Mhm.
you best support me?" So then you schedule a booking.
Right.
Anything
So, I
different in the
mean,
way you're scheduling work?
we encourage folks to have like a scheduling process because this going back and forth email thing, that is so 1982. We're not doing that anymore. Like, you need a
Yeah,
scheduling app. There's so many of them that are free. Acuity, Calendly, Square, all of those things. They do have a free version where you can just do like real simple like scheduling app. Even Square, I used it the other day, and I'm on the free version, and they'll text reminders. Dude,
yeah, yeah.
that's golden for that hour before your appointment. So having them go to there, you can text them the link real quick to whatever your site is, and they can just go ahead and then pay right there, then and there. Because these
Very
things, we still have
important.
to make a living, folks. It's all well to do these things and give some for free and do pro bono based on someone's financial situation. But you have to think about Entergy here at my house. Yeah, they know COVID is going on, but they need some coins to keep these lights on. You understand?
Yeah, yeah. Yeah. Well, one, I love Calendly. I love Square. I love, anything that can keep me organized. And I've had good experiences with them when booking with other practitioners for my own
Right.
personal needs. So I highly, highly recommend that for sure. But yeah, let's talk about that money real quick. So I know
Right.
somebody's got that question. Don't worry about it. You don't have to submit it. We're gonna tackle that first. So there's a bit of a debate, right? About you're
Right.
providing this service, but it's not quite the same service. You're not
Mhm.
touching, feeling, weighing baby in
Right.
that moment. Should we be charging the same that we've always charged?
Right.
And how might your fee scale look different in the time of COVID? What do you think,
Right.
Nikki?
Some people are getting really caught up on this scale and the weights, and like that is the value of that, right? So they're putting like a $50 value on it. They're like, this visit is not the same. You won't be able to weigh my baby. I'm like, bruh, what were we doing before we weighed babies? How did we know that these babies were gaining weight? How did we know that they were drinking these things? This all is on your IBCOC exam. Come with me. Okay, so all these things we still need to know because not everyone always has a skill, even when you did a home visit. So
Yeah.
think about those ways as well. And then you have to think about the front end, like you have to schedule them. If they're self-scheduling, you have to, if you're taking insurance, if that is something that you have with your practice where you're billing, you have to get all that insurance. You're going back and forth. It's not where they come into your office or you go to their home and you take a picture of the insurance card. You're waiting on them. The next step is always on the client and they're not always in tune with your steps, right? So you think it's going to
Yeah.
take 5 minutes. It may take the next 24 hours. So all these things is time, and then afterwards you have to email the plan, and so it takes quite a bit of time on your end. If you're one person, if you don't have front staff, then that's it. It's all on you. So think about how much is your time worth, and bill appropriately for your time, but also bill appropriately for the financial hardships that this pandemic is presenting. So
Yeah,
keep those in
I would
mind.
agree. I would agree. I think that's my answer as well. I think I find myself a little bit torn because some families have lost income through
Right.
this situation, and so I want to be, respectful of that. I want to really,
Mhm.
honor the fact that they're in a tough situation. They still need the help. However, as you said, our time and our expertise
Mhm.
is valuable.
Right.
And if you're anything like me, once you get off of a call, you're exhausted, you are spent. You have given all that. I feel like I'm
Mhm.
giving more in telehealth than I do in
Right.
an in-person meetup because I have to keep the energy level up and really
Right.
encourage while also looking. And, there's so much that goes into it that I want to make sure each of us out there is making sure that we command value for our time. Now, is that 100% what you normally would spend? I don't know. You may
I don't know.
say maybe not because I'm not spending
Right.
gas. I'm
Right.
not. I certainly don't need for Los Angeles. I don't need that hour and a half on the front
Oh my
and the
gosh.
back end
Y'all should
for
charge that triple.
commuting. We do for commuting, even if it's down the street, an hour. So that I can make allowances for that. I'm in the
Mhm.
comfort of my home. I can get straight. I can start up a consult within 5 minutes if I need to.
Right. Right. Right.
As
But
long as
I
I'm
feel like also
decent.
there's a lot of instruction. There's a lot of instruction, like put your
Yes.
hand here. I can't touch you. Tell your partner to move the thing camera over. Okay, zoom down this way. What is that? Like all these things. And I take it a step further because my visits are slightly different, coming from the standpoint of a healthcare provider. A mom tells me she's, lost a lot of blood during, giving birth. And I was like, well, what's your blood pressure look like? Like, do you have a blood pressure cuff? Let me see your foot. Do you have any swelling? Like, point the camera down. So it's other elements of the visit, depending on what you, and then if you want to do a pump assessment, oh my gosh. So there is a lot of instruction, and then being able to articulate yourself in a way in which they understand what you're trying to tell them to do, right? So there's a different skill set that comes out with telehealth for
Yes. I
sure, that
was
we
just
may not have
thinking.
tapped into.
That may be a whole nother Q&A session, just for real, because there's a skill set, there's a certain level of acumen that each of us probably needs to ramp up
Hmm.
in terms of having these discussions with parents and how to even direct them to do things in this kind of mirror
Right.
image that we're in.
Right. Right.
And it doesn't go well the first time or second time or third time. It doesn't go smoothly. That's what my
Smoothly.
hope. You
Right.
really, yeah, you gotta get some practice. And really, what I ask my clients for is a lot of patience and grace. Hey, you know, this is new for all of us.
Right.
And I'm gonna say, show me your left and I mean your right sometimes,
Right,
you
because
know.
it's like it's different. It's different, and we
Yeah.
have to watch our jargon. We have to meet our clients where they are.
Yes.
Um, we can't expect them to like, oh, you should really have this type. Like that bottle is just too big for their mouth. You're like, actually, you don't have to work with that bottle because you really can't go to Walmart right now. You know what I'm saying?
True.
And Amazon Prime is not today,
Yeah.
so we don't have to work with what we have and really think about foundation mode of okay, basic. How can I get her? And then, so if we continue thinking about the anatomy of the visit, like going into our visit, how do we set it up? How do you make sure you use the most of your time because you don't have time to do intake? And I know some people do this already. In some of the groups that I'm in, of if you don't have your intake in, bro, you can't get this visit. And I'm different. Like I do intake right then and there because I do understand that with my clients, sometimes it is if they read it, that doesn't necessarily mean they understand the question.
True.
And so I go through the questions in a way in which I want them to think about it and we go through. So I have that extra time built in. But for telehealth, no, those intake, it really has to be done ahead of time because you don't want your visit to be an hour and a half, 2 hours. I would say telehealth. We got to keep it. If we're thinking about it from a healthcare provider standpoint, if you do telehealth right now, it's 15 minutes. So if we do lactation,
Yeah.
it shouldn't be like an hour and a half, 2 hours. That's exhausting to be on the phone.
That's a great point. I think it's important here, and you all probably, are aware of this, but it's an important reminder that most public health materials are written at a third or fifth grade reading level. And
Hmm.
so if we're sending them a stack of things to fill out, we got to understand or first make sure that the language that we're using is common
Right.
language. They understand where they're being asked so we can get honest answers. We can get as much as we
Hmm.
can from them, but also keep it, kind of brief. And you may want to, scan back over it in the virtual
Right.
meeting. Say, hey, you said here, blah, blah, blah. Are we on the same
Hmm.
page? Do you mean what I think you mean?
Exactly.
Well, I know I asked this question. It could be tricky. It could be taken different ways. Let's make
Hmm.
sure we're on the same page here. So super, super important to make sure you're speaking the same language because you don't
Right.
want to give them some marching orders and they are doing something completely different from what you envisioned
Right.
based on that. So yeah, so checking our terminology both in the consult and also on anything that we give them before and after is really important because we're just not there to model it as we might have
Hmm.
been in another
Right.
setting. So that's a key point.
Right, right. So making sure that we're obviously meeting them where they are, and everyone has a different way of comprehending and understanding things. Like I'm a visual person, so this is telehealth is actually kind of hard for me. And I'm tactile also. I'm not
Mm,
that touchy feely IBCOC, but I will ask. But I need to be able to touch it in some ways, and that's a little hard when you're on the phone. But going through your intake ahead of time is really important before your call, so you can kind of look up some of the things that they're talking about. Let's say if they're on a medication that you're not familiar with, it gives you that extra time instead of during the thing like I've never heard of that, and you're trying to Google it real quick. It's really all that preparation for your visit, and that's why they take a little bit more time. So in starting the visit, you want to let them talk for like 10, 15 minutes. And you want them that get that problem out. I want all aspects of the problem. You can ask like, oh, when did that happen? Is it what makes it better or worse? But you want to minimize your talking as much as possible because that just is going to prolong that story. All right. um, not that it's a
and it
bad
may cut them
story.
off or take them in a different direction, right? And you miss
Exactly,
something key.
exactly. And
Yeah,
they start talking about their kid being home from homeschool. And I'm like,
yeah,
that's not what we're talking about today.
yeah,
Um, so you want to bring it back
yeah.
around. And
Yeah.
then after that, because I was from my standpoint and what we've all heard, the majority of your visit is history. Like if you don't get a good history, it's going to be very hard to provide the appropriate interventions. And so you have to be able to listen and not listen to respond, but listen to understand. And that's the thing
Absolutely.
because we're always listening to, oh, I can't wait to, I'm trying to, and you're like, I should really just keep listening. And I learned
That's a
that
great point.
very from Health Connect One. But
So
But yeah, so listening to understand what they're talking about. And then as you go through it, you go interventions. And then you say, try this, and we go through our, feeding or pumping session or bottle session or whatever. And then after that, then you give them a plan. Now, in our plan, our normal plan that we have at our clinic, it's a sheet of paper and there's check boxes, and we can go through and check the things that we would like for them to work on, and then we can freehand stuff on the back. On this telecall, sorry, televisit, I like to give them 3 things to work on, especially during these times when so many things are on their mind. 3 things. That's it. And I want you to work on these 3 things, and I'll follow up with you. And then when I follow up with you in like 8 hours, because I know you've had a couple of more feedings, then we can add another. You tell me how it went, and then we maybe can add another thing onto it. Because I felt like the other day we tried this and we gave them like so much stuff on their care plan. She was like, I'm sorry, I ain't gonna be able to do it. And I said, okay, that's cool. So I
And that
scaled
that
back a
is what
little
it
bit.
is.
Right. I
Yeah.
scaled back and I was like, okay, well, you're right. I gave you too much. I'm sorry. So we scaled back, and then I texted her another thing later, and she's like, okay. And then I texted her another thing, and then we got to our full. I mean, mind you, it was a very complicated situation. We had like 7 things that we need to get through, but we got them baby steps, and that's why this visit is a little bit. It's a little bit testy. So it's a
It
testing
is.
situation.
It is. So we do the client discussion, or let them talk for 10,
Yep.
15 minutes, and then we dig into history, ask questions, try some interventions, and then how do you wrap it up?
Yeah. So I always have issues wrapping up visits.
That's
Not in the
why I
home
gave
though.
that to you.
In the home, I don't have any problem because I'm like, this your house. I'm about to go. But in the office, I'm like, it's an awkward thing. Like, you have to go.
Yeah.
But it on the telephone, it's kind of like they just keep talking and talking and bringing up the same things. And I was like, let's just focus on. I know you have all these things you want to work on, but we're gonna focus on our top 3 things, and those things usually include mama's mental health, because that's one of my biggest things. Like, if her mental health is not right, I don't care how many tips I gave her, it's not gonna work.
Yeah.
None of it's gonna
Yeah.
work. So mama's mental health. Number 2, your supply, and number 3, the baby being fed. And so where those tips around are grounded in those 3 things. So we work on those, and then we'll add something else. But yeah, we actually taught during the visit. We switched over because you can share your screen. We use Google Meets. You can share your screen. We switched over to Dr. Gahiri's mouth assessment, and we played it for her, and she did it as, now mind you, I couldn't see what she was doing, but she was doing it as she saw the video, and then we flipped it off, and then I was like, show me exactly what you did. And she did it, and she's like, I see it. It's a tie. And I was like, amazing that technology works that way.
That's
So trying
fantastic.
some different modalities during that time of switching your screen, if you feel comfortable, do a faux visit with your friend,
Yeah.
and go through and switch through your stuff, and see how it works in your transition. So don't be afraid to do those types of things either, to prepare you for it. But I know some of us, like, we need to get in it. We need to start seeing these clients, and we don't have time for practice. So hopefully
Yeah.
these tips can help you navigate that.
I hope so. I think I hope it's been valuable, going through those parts of the consult. And we've got some fact sheets here in our handouts. One of them is telehealth resources and tips, and it walks
Yep.
through what that 40 to 60-minute visit looks like, the whole anatomy of a consult that we just
Mhm.
shared. While Angela, I think, is getting ready to bring us a question, I wanted to ask. I know for me, it's sometimes distracting for me if the client has the family has kids running around and banging and distracted. Um, I roll with it. I say, okay, oh, okay, all right, I'll wait a moment. Oh, yeah, hey, husband, hey, niece, whatever, we just go with the flow
Right.
and try to keep them focused. I don't do this, but do you require them, to have any special setup, or, got them in a quiet room, well lit, all that? Do you mandate
Right.
any of that before the call? You lay out any
We do send
parameters?
in some tips. It's called Tips for a Successful Call.
There we
Um,
go. Okay.
There we go. And so we tell them to, like, get in your spot where you breastfeed comfortably, right? Because the parent's comfort is just as important as the baby's comfort, because we're always trying to make baby
Yeah.
comfortable. And the mom was like, over here. and she really need to go see a chiropractor. So mama's comfort, get whatever gadget you need for this visit, because we like,
Yeah.
all that stuff, have all your parts and stuff ready with you, your boppy pillow, whatever you're going to use. If you use anything, we don't require it, but we do require something so we can, you know, minimize the amount of times that you have to manipulate the camera.
Yeah.
Uh, Turn off your TV, because we have caught people, they're just glancing up.
Yes.
I'm like, are you watching Netflix? I'm gonna need you to turn it off.
Yes.
Yeah.
Yes.
So doing that, having them some water nearby, because I want them to stay hydrated. And like I recommend that for the LC also, like having yourself some water by. Yes. Mm. Having some water nearby, because
Excuse
you're
me.
gonna get dry,
Yeah.
and you can't get cotton mouth while you're sitting up here trying to help the woman with a breast.
That's it. That's not
Um,
appealing. Yeah.
No, no. So that, and then minimize distractions as much as possible. Like, can you be in a space? Can you have some time for at least, I say 30 minutes, but this bit's gonna be like 45.
Yeah.
For like 30, 45 minutes where, it's just us. And can you have someone help you with the camera? Will someone be available? And we've had mother-in-laws, we've had partners, we've had the doula that was there, and they help with the camera, and they've been maneuvering it around and stuff. So yeah, those are some of the key things. But distractions are we try and keep those down. But sometimes the kid can help. I mean, sometimes they running around, just hold a camera, baby, and
I mean, it's real. Y'all may see
right,
one of my kids running around here in a minute. It's real. We're
right,
operating out of our home spaces. Hopefully,
right,
the provider has a quiet atmosphere, even if the family that you're
right.
supporting doesn't. But we understand that they've got life going on, and we're meeting them in their home. So
Right.
it's the same as if we were there in person and they had toddlers constantly, asking for snacks or whatever. It happens. It happens.
Yes.
All right, I think there's probably tons more technical stuff we could talk about in terms of which
Right.
platforms. And I want to, before we hang up or end, I want to talk to you about text messaging support.
Hmm.
Because not everybody has a smartphone, not everybody has access to the internet. We're learning this as schools are closing and children don't have access to do their schoolwork.
Hmm.
As much as folks had assumed, oh, we'll just have them log on to the school website and do Google Classroom, and not every child has that. Not every family has access to
Right.
these types of tools. So, but I'll pause there because I think Angela's waiting excitedly to ask us something, and we'll come back to other
All right.
alternative methods of compost.
What you got, Angela?
Hey, I've got a few
Hey,
things that have been
Okay.
coming in. Hello. So, biggest question really is, can you please repeat the Dr. Gahiri website that you
Oh, it's
use and what part
yeah.
of it do you use?
Hmm. So it's Dr. Kahiri, I believe it's drkahiri.com. And you can go on there, and it just says oral assessment under resources, I believe it is. Um, yeah, I think it just says oral assessment, and it's a video. Like he has some, is it called Vimeo? That's what I think it's called, Vimeo video.
Vimeo. Mhm.
Them too. Um,
Can you spell, can you spell his name?
uh, yeah, Google's got to spell it for me. Um,
It's
GHAHERI.com. DRGHAHER.com. Dr. Gahiri. And he has a video that kind of blows up pretty big, um, of let's see, maybe it's under before a visit. No,
I
it's
saw it
under.
under resources. You were right.
It's
Going
under
under
research. Oh,
resources.
okay, cool.
Yeah.
Okay, cool, 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 cool. Yeah.
Yeah. There we
So
go.
going under there and then watching the video, letting the client watch the video, because some of them, some of the clients, whether it depends on if they have a pediatrician that is in tune with and believes in TOTS, whether they're going to address that, and if the oral assessment was ever even done. So that may be their first time hearing the phrase oral assessment. So give some explanation ahead of time of like what's going to happen. Have clean hands. Giving them a little uh, tips beforehand is helpful.
excellent.
Great.
And
And
so
thank
another
you, Angela.
question,
Sorry,
absolutely.
Angela shared the website there for you all, in case anyone's looking for it.
Actually, that was Steve, so thank you, Steve.
Oh, thanks,
And
Steve.
someone else actually just put it in the chat, so I'm going to add this piece. It also talks about aftercare, and that's
Mm-hmm.
where he has his assessment and his picture. So I just
Mm,
popped that into the chat. Thank
Yes.
you so much for that URL. And so related to that, there's a lot of questions about weight checks. How do you do a weight check? If someone suggested that they drop the scale at a client's home, and someone else is asking, how do you do weighted feeds?
So weight checks are interesting.
Mm-hmm.
And
Mm-hmm.
I think before we even talk about weight checks, we just talk to them about the basics also, because there's a lot of anxiety surrounding how much does my baby weigh, how much does my baby weigh, how much does my baby weigh, and while that's important, it is to see if the baby's it's one of the ways in which we can determine if the baby has had enough to eat. But we also was like, how do the diapers look? How does the baby feel to you? Like, let's use some of those basic gross things that we can do until we get to these little finite where we're looking at the ounces of um, or the mils of how much this baby is taking. At our clinic, I can tell you how we do it at our clinic. Um, we just implemented a weight check day. Where it is where they have access to a room that has been sterilized, and they do 15-minute visits, and they go in there is nobody in there with them. And they go in, and everything's been cleaned, and there's an instruction on how to do a weight check. So they fed their baby before they come in, and then they go to a different room to feed their baby, and then they come back and weigh their baby. Or they can do it another way. They can just come in to just get a weight. Like their doctor said, well, I need a weight. Now, in our area, some of our pediatricians' offices, despite how dire it is in New Orleans, they are still open. So they are seeing well babies in the morning and sick babies in the evening. So I would also check with your pediatrician's offices as well. I know some people are dropping off scales. That's all about your comfort level. If you have a $1,000 Tanita, you have to think about the safety of that scale, and you're really, I mean, it's a judgment call. It really is. But I would say start with the basics, and maybe Nikki K, you have some other suggestions?
I don't, yeah. So the facility where I do my support group and often see parents is now, it's a public health department site where they're actively testing for COVID-19. And so it's not a space where I want to have infants brought into. So we are not doing anything at that facility. So because I only have my one expensive scale that I won't be dropping at anybody's house, it's just not a thing I can provide at this time. However, to your point, unless it's a dire, emergent type of situation, or where we are really watching the ounces to see if we need to take some more extreme measures with the parent, I'm going away from weighted feeds. And I actually in my practice don't do a whole lot of those.
Yeah, me
I
either.
think they can be so misleading. And we know that just like you eat a different amount, different times a day, so does baby. And it tells us less than we think it tells us. And so I generally try to stay away from those and try to get parent away from being married to the scale, as many are with healthy babies. It's not even necessary. So that's the thing I try not to do. So I definitely rely more on watching a feed, seeing if the latch is right, seeing positions right, seeing what the diaper output is like, and making sure they're feeding on demand and keeping really close tabs on output and the way baby looks, getting my eyes on baby, even if it's through the screen,
Right.
and continuing to kind of stay in closer touch with the family that is concerned. But to your point, there are pediatricians' offices that are open for this reason. I mean, they have to stay open because they're seeing babies, children with other types of sicknesses at this point,
Right.
in addition
Right.
to COVID, right? So,
Right. And there are no recommendations right now for, at least I haven't seen from the American Academy of Pediatrics, on regular newborn checkups. Like, what if a parent just had a baby 72 hours ago, and our recommendation is that they go to the pediatrician? Is
yeah,
that visit still happening?
yeah,
And I think it's up to the discretion of the office, and that's where we get those weights. And then, you see them again in a week or 2 weeks. So we don't have those guidelines. So it's going to be very hard to say which offices are open and which aren't, because it's up to the discretion of the office and the staff. At some places, I spoke to someone, they say it's the age of the staff as well, and some of the
oh,
comorbidities that the staff has, like they're basing it on that, as opposed to any guidelines regarding pediatrics, is that the staff are older, right? And
Yeah.
things like that. So we have to, this is real stuff. And we have to understand that our visits just won't look the same. And
Yeah.
that scale, I feel like it takes up such a big part of our visit. And there's so much other stuff that we could teach the other families. But I do know there are some situations with failure to thrive and all those types of things where that comes in. But I feel like that is actually a smaller percentage than we give it more credit than what it really is.
Yeah.
And
I
I'm
mean,
sure I'm going to get a text or email about that.
well, I have been encouraged by the physicians here who are doing this doing telehealth as
Mhm.
well. So they're getting eyes on the baby. I'm getting eyes on the baby. You know, their parents are constantly in touch with professionals who can help to assess whether or not things are going well. And I think that's probably the next best thing
Right.
at this point.
Right. Exactly. We're trying. We're all adapting.
Yes, exactly. So people are really asking about your specifics as far as what telehealth tools are you using,
Mhm.
what are the
Mm.
best type of telehealth services and platforms. And before we get into that, back it up a little bit. So there's a couple of questions about, can any IBCLC provide telehealth appointments, or what other certifications can provide, or other certifications do you need? So could, for example, our certified breastfeeding specialists provide these sort of telehealth visits? And do you
Mhm.
need to be a nurse or an other sort of licensed provider, in order to offer telehealth?
Well, I'll jump in there. You see the letters behind my name. There's not a single N. I am not a nurse of any type.
Mhm.
And I've been doing this work ever since I was a volunteer, peer-to-peer supporter. I've been doing some type of telehealth support. So yes, I cannot stress strongly enough how we need to work within scope. So during those days, I was doing breastfeeding education, doing a little bit of, support with latch and stuff. These days it's much more clinical now that I'm an IBCLC. But in
Mhm.
my opinion, I think that we are all equipped to do some level of support in
Yeah,
this way.
absolutely. Yeah, yeah, yeah. And I think some people we're right as of now, especially with the COVID stuff, we're using telehealth and telemedicine interchangeably. And they're actually, you may see it some places where it's used interchangeably and some things where it's different. And I said we are using telehealth
Yeah.
as lactation professionals. Um, and as a provider, when I put on my nurse practitioner hat, I am using telemedicine because if I assess, diagnose, treat something, that is using that lane. So we just have to be careful about what we're doing and what we're saying. Like, are you making a diagnosis? So that's when saying the scope is
Yeah.
important, right? But you don't need to be a nurse, and this is just another arm of your practice. Whether you're working as a certified breastfeeding counselor, a COC, or whatever, it's just another arm. Even if you're a WIC peer counselor, WIC is not open. So you're going to have to meet them where they are. And if it is
Yeah.
seeing their face through a screen as opposed to seeing their face sitting in your chair in your office, then that it is what it is. It's just location. That's all it is. It's just a
That's
change
it.
in location. But your words and what you're saying is going to be absolutely the same.
So to that, you just said something about WIC. And so
Mhm.
one of the first questions we had was, is the WIC program shut down?
It is a state by state situation because my WIC program here is drive-through. And they have on gloves, you come, they have a little drive through thing, you hand them the stuff, they bring your stuff out. And that's how it works here. I do know up in Jersey, I heard something that it is not working that way. I've heard in some areas where
Yeah.
you can walk into the office, but it's like, 2 or 3 people at a time. So I think it's all dependent on the
Yeah.
office, to be honest.
So I don't know this definitively for Los Angeles because things change. It's such a dynamic situation. Things are changing so much. There's things we say on this call today that will be different next week, quite
Oh,
frankly.
they'll be different tonight.
In next hour, right? But to my knowledge, the offices are closed or offering very, very limited support to families. And so families are just kind of on their own and hopeful that in the new month, there'll be a better strategy for how to get their resources for April.
Right.
Super
Yeah.
helpful. People are actually popping it in the into the chat. So
Yes.
Vermont has moved to telehealth. South Carolina is open and well and doing remote certifications and counseling. Texas WIC is open, but based on each county or city. And I do know that in Virginia we're doing drive-throughs as well, drive-through and
Okay.
phone certifications. So
Cool.
it is really quite dynamic. So getting back to that question though, what specific platforms would you all suggest?
So my friend Nikki here has had the opportunity to research them all, dig into them, see what the parameters are. So I'm gonna let her take a stab at answering that first, and then I'll talk about what I feel most comfortable using generally.
So I've used a few, right? So as many of you know, let's start with the what we've been told by the federal government is that they have been lax. There's no consequences for not using HIPAA compliant resources or platforms. Now, as a nurse practitioner, that scares me a little bit because I feel like that's a hacker's dream. But I do understand the situation that is before us and that we can't always use that. And a couple of days ago, I was kind of upset. I was like, oh, you got rid of HIPAA? Like, you should have been forgiving student loans or something else. Like, I don't know why you got rid of HIPAA. But as I tried to contact some of my patients, I have a clinic at a homeless shelter, and I was trying to set up telehealth with my patients at the homeless shelter. Yeah, we're gonna have to get rid of HIPAA, okay? Because some of the platforms require you to download an app. They require you to set up an account. They require you to have, like Google Meets, you have to have a Gmail account. And while last week we did it all and everyone had a Gmail account, I hit somebody yesterday and they're like, I don't have Gmail. I'm like, well, what do you have? Like, why wouldn't you have a Gmail account? She's like, I have a Hotmail. Hotmail, ma'am. But this is reality. So I was like, okay, well, we can't do this. So that's one of the downfalls of Google, anything that requires an app. It is an extra step. It
Yeah.
is like not everyone has Android or iPhone. People have different phones. I even encountered my first person with a flip phone. I don't even know how we communicated, to be honest.
Yeah.
But it is what it is. And so they don't have that ability. So we have to figure out another way. Doxy, I know some people were using Doxy. I haven't personally used it, but from the interactions I've heard from others, it's glitchy. It's been really glitchy lately, and I wonder if it's just because so many people have been on it and it affects it in some form or fashion because you don't have to actually download an app. Zoom, I used it last night and it worked really well. And it's free, the free account. A lot of people have laxed their stuff a little bit. Loom is one that has come up a few times. Loom allows you to exchange little small videos back and forth. Like let's say you aren't able to do the full video for whatever reason, the parent can send a small video to you. You can send it, and they disappear after a certain amount of time, kind of like Snapchat. Some people are using WhatsApp. If we really want to get basic, WhatsApp and FaceTime. So at this point, because that those guidelines for HIPAA compliancy have been laxed a lot, you can use whatever really works for you. But we want to make sure that whatever we're using, that we're not recording anything. And that was the whole point of the HIPAA compliant platforms. They do not allow you to record any of that, so it cannot be stored. So think about that and when you're using the platforms.
So I'll read that real quickly, what Nikki's referring to. The Office of Civil Rights at the Department of Health and Human Services has decided that they will exercise their enforcement discretion and will not impose penalties for noncompliance with the regulatory requirements of HIPAA rules against covered healthcare providers in conjunction with the good faith provision of telehealth during COVID-19 national public health emergency. And that was effective immediately some days ago.
Right.
Thank you, Nikki, for sharing that. Yeah, so those are a lot. So I have tried a number of things over the years. WebEx was a thing. Google Hangouts I did recently with some folks, and similar to Meetup, it works best if you have a Gmail account, and gets a little tricky if you don't. Folks have trouble getting in. Folks like me who have 7 Gmail accounts.
I know. Oh my gosh.
Have to log in with the right one and switch accounts, and it's a little bit annoying there. it has some limitations in terms of what you can do. I more consistently use Zoom. The free account has a 40-minute time limit that's been lifted for schools for some Gmail on some email account handles, but I found that I keep getting kicked out at 40 minutes. So I went ahead and just
So it just
subscribed.
shuts off? Is that what it does?
It just
It's gonna shut off?
out. Yeah, everybody's out. You got to send a new link. Yeah, and I've heard from a number of people who said, "Man, every time it's approaching 40 minutes, I get a nice warning on the screen, and then it says, never mind, we're gonna waive that time limit because of the COVID thing." But for me, I didn't get that. I just keep getting kicked out. So I went ahead and just paid for the Zoom account.
So tell me, so I would like to know, like for Zoom, walk me through, like they create an appointment with you and you just send them a link and they just use that link. You text it to them. How do you send the link to them?
Yes, I text the link or email,
Okay.
actually both. And so they can come in either through their phone, but they need an app. Generally on the phone, it works easiest. On the computer, they can go through the Zoom website. And so it doesn't require a downloading of it. There is some, a little bit of a, to access it, there is a quick download, but you should generally be able to do it from their website without a whole lot of other roadblocks. And I'd love to hear from anyone out there who's having a different experience than I am with that. But yeah, it works for me. I can screen share. We can, now talk unlimited. Now I'm paying for it. And it's been, I'll be honest, it's been a little bit glitchy and there's been a little bit lag now that swarms of people are on the system.
Right.
So it helps to choose times of day that are lower traffic. And that's a strategic thing to do there. But Zoom has been my go-to so far. They have a Zoom, they have set up a telehealth kind of page to give you some resources and insight. And so they recognize the need for healthcare providers to do some type of telehealth and telemedicine support. And so they're, I find, to be user-friendly at this point. Okay. Yeah, so that's my go-to. Yeah. Angela says someone has asked, how do we decide when the visit should be done via telehealth versus in person? For Nikki and I, we don't have the option any longer. Our cities are completely shut down. I imagine most of you will be in this position within a week or two. However, if you still are in a position to have the option, how do you make that decision, Nikki? Is there a tool that exists?
Oh my gosh, yes. There is. There's an algorithm that we worked on for several days. And I think I started working on this algorithm on Friday, I think it was Friday the 13th. Friday the 13th, I submitted it on on Saturday night. Sunday, we had to update the algorithm because the guidelines had changed. And then we went on into Tuesday updating the algorithm because it's changed. So right now we're at what I think is a pretty safe algorithm, which we've shared. And it's one of the downloads up on
Looks like this.
Oh, there it is. Beautiful.
Looks like that. There you go.
I'm asking a few triage questions. Have you been sick? Has anyone in your home been sick? Have you come in contact with anyone that's positive for COVID? So there's some things, fever, coughing, shortness of breath, and things like that. And referring them. There's also a piece in there to refer to their PCP, like you should really go see somebody. But we can continue with this telehealth, but you need to go see somebody. And then others, they're like, I can't see you at all. Like there's no telehealth for you. You need to focus on this first. And then the other part is doing a home visit. And with your home visit, there are things, and we have another document there to help guide you through your home visit and how you should clean down your stuff based on CDC guidelines, because clean and sanitizing are two different things. And so making sure that you're aware of those parameters, and get yourself a good box of gloves and the whole thing with the mask situation, that has even changed a lot. It's on a preference. I think at this point, I'm not even sure what the guideline is for mask wearing anymore. So I would check with your particular space for what mask, and then the availability of masks, because some hospitals here don't even have masks.
I believe the latest guideline from CDC was that, definitely N95 masks are the best, but they're completely out everywhere now. Right. So they're saying, a t-shirt or bandana wrapped around your face is better than nothing.
Right. And then you also have to think about like how does that go for comfort? in a space. And then that 6-foot distance thing, how does that go for visits as well? Like we have to, be appropriate for the pandemic space, but also be appropriate as a provider space.
Yeah.
And I can't see anything from 6 feet away, especially with
Yeah.
no glasses on.
It's
So
it's almost impossible at this point to provide the
yeah,
level of service and care that we want
want
to
to do
with keeping social distancing directives in place.
right.
We have to protect ourselves
Hmm.
at this point. Next week we're going to talk a bit about hospital support
Yes.
because I hear there's some questions about how do we do outpatient lactation support for hospital clients, and we'll talk a bit more about that at that point. That will be changing over the next several days, depending on where you are. Right now, there's lots of uproar about how many visitors can go in with the parent, when they go
Yeah.
into to give birth and such. And so some of that will absolutely impact whether you can go in to help someone with breastfeeding.
Right.
I would imagine that's not even going to be a thing in the
Right.
next
Ours
days
is
everywhere.
definitely changing here. I mean, for the folks in Louisiana, specifically in New Orleans, like it literally, we just got an update yesterday. Like they shut all that down. Doula, no. Last week we were doula, yay doulas. This week, we're not playing
No.
that.
Yeah.
So it is what it is, and we have to comply. But we do know, what the evidence shows, right? So
Yeah.
so we do have to think about in things of in our practice and stuff what evidence shows and what practice has become because of panic. And so keep that in mind that just because it's happening doesn't mean that's what evidence. So make sure you always go back, reference the evidence, in the words that you use, and as things are coming up, question, is this true? Where did it
Yeah.
come from? And make sure it's a reputable source.
Speaking of which, we've got in our handouts resources for lactation supporters providing infant and young child feeding advice during COVID from ILCA, fresh off the presses,
Yes.
wonderful resource, links directly to WHO in their current recommendations. And we're very, very excited about that.
Oh,
Sorry,
thanks,
I was
Angela,
trying
for
to
putting
see.
it there. Oh,
Yeah.
that was
All
she
right.
put in the mask thing.
Nice. All right. So yeah, sorry, Angela put something in the chat that's going to be helpful for all. But please check out in our handouts that ILCA document. It is again live. It's linking to the newest, latest, and greatest information from who we are all following for updates and changes and trying to keep up with because it's going fast. Is there any
Right.
more questions for us, Angela?
Well, yeah, I think you sort of addressed it a bit, but the hospital setting is something which is really pretty, a lot of people are asking questions about it, and
Right.
especially for those who are doing outpatient visits. There's one group where they've got 8 consultants, and they're seeing both inpatient and outpatient visits about 50-50. They've got to do belly checks and weight checks. So, I guess if we can, keep an eye on that over the next week to find out what our organizations, hopefully there are going to be some national health organizations such as AAP, AAFP, the family physicians, even, and or nurse practitioners who are going to come out with some sort of guidance on this. But yeah, you're right. I mean, the visitor policy last week, New Orleans had doulas, and this week they don't.
Right.
And so it's just really it's really happening just so quickly. So it's really quite frustrating.
And as
Do
this
you
thing
have?
goes in waves across the country, we're going to see, advice that Nikki and I might give you from, places that are in the most distress may not even apply. You may be a
Right. It
few
may not.
weeks
That may not
behind
be your
us in
situation.
your local area.
Right.
Yeah.
Right. And I
Right.
want to encourage everyone, just as we wrap up our call in a little bit, that you check in with yourself, your mental health. And I know a lot of us are pressing, like, I need to keep my business. But you need to keep yourself well, like mentally and physically. So check in with yourself and don't rush it. Like, if you don't have to, don't press so much, because things are changing so much, and some of us are running ourselves ragged trying to keep up, and it's just not. It's not worth your mental health. It's not worth your physical health. So with all these guidelines, just take some deep breaths, and we're gonna get through this together. And that's why we're having these things to kind of, you know, calm it out a little bit, as far as just getting all this information all at once. It's not, we can't fully digest all this stuff at once. So we're just taking it bit by bit.
Thank
Quick
you for
question.
that. Thank you. I
Absolutely.
want to echo what Nikki said really quickly here. I think this is unprecedented. I don't think any of us have lived through anything quite like this before. And so you want to give yourself some grace and really be patient with yourself and understand that you are probably experiencing this in deeper ways than you even realize.
Absolutely.
And so not only are we in the time of a pandemic, this is quite likely, based on what the scientists are saying, going to be a thing that lasts for a long while. And so that we will be dealing with the repercussions of this. We're dealing with what's happening in the moment and then the repercussions of it for a very long time. And so this shift in the way that we approach our work is going to be lasting, but that also means that we are going to be in this place of stress, and for some it's trauma, for a long while. So you want to make sure you are constantly checking in with yourself and doing the things you need to do to reassess, and learning about a new way to approach your business.
Right. Yes.
So that you can keep going, keep earning income, keep being a support to your community, while also protecting yourself and keeping yourself whole for this long journey.
Right. And one thing that we didn't touch on, and we touched on it a bit about, how can we provide resources to families that cannot afford it? And, you can still have your support groups, but they have to be virtual. And that's where Zoom comes in, because it does allow for, all these screens, Google Meets, it does allow for the things. So giving them these logins, the meeting codes, and y'all sit there and y'all all looking at each other in whatever, pants situation you want to have on. And y'all are having your support group and you're supporting them. And whether you make it 30 minutes or 45 minutes, is whatever, just as a virtual check-in, like, how is my community doing? And they can express small concerns. And then from there, for those that have the need, greater need, then we can pull a visit from there. But don't forget to utilize, there are some people all over the country that are doing these things all times of the night. Midnight milk.
Midnight Milk Club. I was thinking the same
Midnight
thing.
Milk Club.
Yes,
Genius.
yes.
It's working amazingly. And I want to encourage you, don't forget about your support groups. That is the foundation of lactation support, is our support groups, and we build upon that. So because not all these issues need a 45-minute visit. And if someone has created a 45-minute visit and they're like, well, I just have this small question, we could have maybe handled it at a support group level. So don't be afraid to say, like, support group of, this little town that you're in, and you create a Facebook group or whatever, or Zoom or whatever, and reach out to all your clients that maybe you've had in the past month. Send them a code and say, hey, we just want to have a real support group just to check in and see how we're doing. And that can be the creation of your support group that you may have never had.
Now more than ever, folks need community. They need community. If they're isolated, we know that being a new parent is isolating in itself, but now to officially not be able to go out and intermingle with people takes it up a whole new level. So if we can create community for them and a place where they can, interact with other parents safely, I think that's golden, for sure.
The silver lining is the innovation that's going to come out of COVID-19. That's the silver lining, if you can find even the smallest slither of it. Anything else, Angela?
That's perfect. So as far as the evidence-based resources, so just so people know that when you actually logged in, we had handouts which were there. And so you can easily download those handouts, or you can go to, and we've popped it into the chat, lactationtraining.com/COVID-19. Also, the other reference that you had was ilka.org/COVID-19. And one thing I really want to note is that it's really very important that you ensure that the resources that you are utilizing are from the actual organization themselves. There's a lot of interpretation out there. Even I was watching on the news, they showed a graphic, and you could see where the statistics on that graphic, it was an interpretation of an interpretation. And so it really is important for you to go to your source documentation. And all of us who are working in the community and or in any sort of healthcare, you've always got to go to the source. It's not okay to pull something that you just happen to see online. And so where have you two found any evidence-based graphics that you can utilize, either for COVID or for just any sort of, communication that you want to give to parents if you're doing a support group or a class? What are some good graphics you like?
My friends at Lactation, Education Resources.
Yes.
Yeah, I love y'all's graphics. I always look there because I know that you're going to check it 10 times.
Yeah.
for that. I've been going personally to my organizations that I'm credentialed with. So American, I don't know, AANP. That's where I've been going. Nurse practitioners in women's health, because I know that they're giving disseminating information to tons of people. I've been going to ACOG, so I've been getting the stuff from there. CDC, they've been trying to. I know the language on there. When I went there the other day, I try not to send my clients to the CDC because it is not written in a third grade reading level. It is written in a very scientific way, and some of the, if you really like tap on some links, and you're like, I don't. There's words are just everywhere. So something that is really important for me with my clients is in my phone and the photos. I have an album that I call visual aids. And I make sure that all the visual aids that I send are evidence-based, coming from American Academy of Pediatrics. I like Kelly Mom. Kelly Mom tends to double check the stuff that
Mhm.
that she puts out. And I send them visuals also, as opposed to like reading stuff, sending them articles. If they can get a visual, then I tell them, then I send a link with it to read some additional stuff. But I do
Yeah.
try and send visuals to my clients and even to friends, because I know um, we can't. I mean, unfortunately, people don't read as much, and don't have the time or capacity to read all through those articles. So hopefully, I can do some of that work for them and just send them a good visual. So, like Leche League, yes,
Yeah. Yeah.
with Kelly Mom and AAP and stuff like that.
Yeah, I would, lactation education resources, La Leche League, World Health Organization has some new
Hmm.
graphics out about continuing to breastfeed. Those are my go-tos. Kelly Mom has also always been a resource forever. So those are the places I go. And then Nurse Nikki makes wonderful
What?
graphics.
Get out. I
Nurse
have to
Nikki
check her
NP.
out.
She's pretty awesome. Always has fresh graphics that she's putting up that are shareable. So those are my go-tos.
Thank you.
Great. Do
Well,
you have a link to your Midnight Milk? Someone is asking.
Oh, what's her link?
that is by Tanifer Lukamunda Kamara. It's a group that she has started. I don't.
It's a Facebook group.
It
Let
is
me
a
see.
Facebook. I'm gonna see if I
It's a
can.
Facebook group, but she does a Zoom meeting. So that's important because she is reaching folks that are not on social media as well, which is super important. Remember that folks, not everybody is on social media. And then some people are on Instagram and not on Facebook, and vice versa. So keep that in mind when you're thinking about your marketing. You're like, I put it out there, but nobody came. Like, where are the majority of your people? Are they on Facebook, or are they on Instagram, or are they off, not on that, in that realm of social media? Are they on
Yes.
Twitter?
Sorry. Yes. Midnight Milk Club. I'm trying to make sure that it's accessible. It's a closed group. So you may
Oh,
have to.
it's here. Someone
Mm-hmm.
popped it in the chat.
There you go. Thank you. Thank you, someone.
All right.
That's how you find her.
Yes.
That's a great one. Yeah, for middle of the night meetings for
Mm-hmm.
parents who are
It's
up
like
late and need a
11,
little help.
isn't it?
It's
Is it
midnight our
11
time,
on the West Coast? Yeah,
or 11 or midnight on the West Coast. So it's
on West
late.
Coast. Mm-hmm.
Excellent.
Okay.
Okay, good.
Yeah, we talked. One other thing I mentioned I would circle back around to was alternative methods. So if the parent doesn't have like video web conferencing capability on their device, good old fashioned phone calls still work.
Oh, yeah.
They
Okay.
do. And I tend to do a little text guidance, but that's a skill as well. And
Mm-hmm.
you want to be careful about, what you say in text because it's all written out there to be seen later for liability reasons. So I
Very
generally do
true.
a little text guidance and then drive them toward a phone call if possible or if necessary. Are two tools that we cannot forget about. They are still very, very valuable
Absolutely.
in supporting folks.
Absolutely. And Marco Polo and all those things like that.
It's excellent. Thank you. Well,
Welcome.
thank you. I'm taking a look at the time, and it seems that an hour has gone by, which I just can't
Oh,
even
Yeah.
believe. So thank
cool.
you both so much for offering so much information. Indeed, we will be providing this. There's still some other questions that are here in the chat, and so we will be addressing those either online, or we'll do our best to address them next week at the meeting.
Okay.
And so thank you very much. So our next lovely opportunity, an hour to interact with Nikki and Nikki, is going to be next week, the same time. You will have to, in the same day, so it'll be next Wednesday at 10:30 Pacific, which is also 1:30 Eastern
Mhm.
Daylight Time. And so in Central Time is 12:30.
Yes.
And don't want to disrespect the mountain folks, so it'll be 11:30. So please do attend. We'll have a link for the registration up on our website shortly. We are also we have recorded this webinar. We've recorded all of these fantastic gems that you all have imparted, and that wonderful energy that you are bringing, and that the happiness and the smiles that we all really need during this time. So thank you both so much for doing this. Everyone in the chat is just thanking you all so very much for
Thank
providing this
y'all.
time and providing this space. And so
Yes.
we will have this on our website shortly. So thank you all very much, and it will be offered for free. We also will have a webinar on excuse me, COVID, and which includes what it is and resources and stuff, presented by Laurel Wilson. And we are fast editing this, and we will have it on our website, and it will be free, a free class for you to enjoy. So we're all in this together. We're trying to get as much information to you as we possibly can. So thank you very much, Nikki and Nikki, for everything that you've offered today.
Thank
Thank you.
you.
Appreciate
Everybody
y'all.
stay healthy. Be well.